Thank you very much, Mr. Speaker. Mr. Speaker, repeatedly, this government has assured Albertans that those appearing before the Health Quality Council of Alberta are protected by the Alberta Evidence Act. In fact, the only protection that the Act affords is against being asked a question about a health quality review in a subsequent court action, medical malpractice, for example. Nothing in the Act protects those who have signed non-disclosure agreements from being sued in breach of contract and breach of confidentiality. So, to the Minister of Health, why does the Minister continue to present the protection the Alberta Evidence Act as something it is not?
Honourable Minister.
Mr. Speaker, I'm not doing any such thing. In fact, there are protections under the Alberta Evidence Act. I've read them here in the House, and if you would like, Honourable Member, I'll read them to you again. In addition to that, however, I also asked the Health Quality Council to make sure that they took into consideration any other protections of privacy or confidentiality that might be necessary, so that people would feel encouraged and comfortable coming forward. And I understand people are, so we'll wait and see what the report says.
Honourable Member.
He's just wrong. Back to the same minister. Given that only a public inquiry can compel evidence and protect doctors from liability, why does the minister continue to refuse growing demand for a public inquiry?
Honourable Minister.
Mr. Speaker, I think it's important to reiterate and keep the record straight that the Health Quality Council of Alberta has already indicated very publicly that their report will be based on fact. It will be based on public input and on input from people in the practice, that they are creating an atmosphere of participation, and I hope that anyone with any information might come forward, and perhaps somewhere we'll get to the bottom of all of this, if any evidence exists, if any proof exists to the allegations that were made. So far, I'm not aware of any.
Honourable Member.
Well, the Health Quality Council can offer whatever they want, but they cannot protect those doctors. So if the government is serious about getting to the bottom of allegations of government intimidation and a culture of fear, why does the minister persist in offering a process that will not allow those doctors with the information we need to speak out freely? Why is that?
Honourable Minister.
Mr. Speaker, no one is denying anyone from coming forward with whatever information they want. In fact, the exact opposite is true. We, on this side, are encouraging doctors to come forward if they have issues that pertain to the allegations. What we've seen so far is a bunch of statements of claim that are basically disagreements between professionals and their employers. That's all that we've seen. But a lot of it is not relevant to the points that were alleged in this House, and this honourable member knows that.